Welcome, everybody. My name is Sarah Judd Lamb. I'm the Executive Manager, Policy Development and Research at Carers New South Wales. And I'm pleased to welcome you to the 5th session of the Innovations in Respite Cafe Conversation webinar series. It's bright and early for us here on the east coast of Australia. I know we have some joining from overseas and elsewhere. Thank you for making the time today. And if you're watching our recording, we welcome you as well. So just wanted to, briefly mention our guest of honour today, Kim Whitmore, PhD, who's going to be our 5th guest speaker as part of this series, and who'll be speaking about a white paper that she recently co-authored, colleagues in the USA, measuring the value of respite. I want to start by acknowledging the traditional custodians of the lands that all of us are joining from today, including the Gadigal people of the Eora Nation here in North Sydney. And I extend my respect to elders past and present, and to all Aboriginal people, including those joining us today. Just briefly about Carers New South Wales. If you're not familiar with our organisation, we're the peak non-government organisation for family and friend carers in the state of New South Wales in Australia. And you'll just see a bit of information on the slide there about us and some contact information. We do a lot in the area of respite, but also in a number of other project areas, and welcome you to have a look at our activities if you haven't already, and to sign up for our e-newsletter, which is how we promote all of the different sessions and things that we do. So moving back to our guest speaker today. So this series, some of you have joined previous sessions it's a bit more of an informal webinar than what we usually do. No presentation slides other than these placeholder ones. And it's really just a chat. And the idea of this series came from the many stakeholders that we have the opportunity to speak with nationally, internationally, about new research, new projects, and just inviting others into that conversation over a cuppa, but in your home rather than in person. So we're thrilled to have Kim with us today. Kim has presented before at a Carers New South Wales conference a few years ago, I think during COVID, very early in the morning, I think, her time. And we first connected with Kim around some of the research that the Arch Network is doing, which she will tell you more about. We recently saw that they had released some exciting new research, which she's going to speak about today. And she's also let me know that there's some exciting stuff coming up, which she will also touch on. But the Arch Network is just a really active network that's very keen to share their knowledge from what's happening across the US, connect with international friends and colleagues. And Kim is also quite familiar with Australia, which is great. So we're hoping to have her visit us here sometime in person in the not too distant future. So wanted to hand over to Kim today and first welcome you, Kim. And we're just going to kind of have a bit of a casual conversation. So I wanted to just start by saying, where are you joining us from today and what time is it where you are?
Yes. Hi. Good evening from the United States. I am in the state of Wisconsin in a town called Sun Prairie, which is just outside Madison, Wisconsin, which is our state capital. It is, as I said, 5:30 p.m. and I just finished a long day of work and lots of meetings and have been looking forward to this all day. So thanks so much for having me today.
Thanks, Kim. And could you tell us a little bit about yourself and what you do with the Arch Network?
Sure. So I am an assistant professor in the College of Nursing at Marquette University, which is a university in Milwaukee, Wisconsin. And in that role, I teach predominantly in our graduate nursing program and lead a program of research that supports family caregivers across the lifespan. And I have the great opportunity to also serve in the role as an evaluation consultant for the Arch National Respite Network and Resource Center. So I do see the executive director of Arch, Jill Kagan, is one of our participants tuned in today. So a shout out to Jill for all the work that she does. She does an amazing job leading the work of Arch, and their mission is to assist and promote the development of quality respite and crisis care programs in the U.S. to help families locate respite and crisis service and to serve as a strong voice for respite in all forms. And they do just some amazing work. And where I get to chime in is on the research and evaluation piece of that, which I'm going to talk a little bit more about today.
Fantastic. And if you haven't looked at the Arch website and e-newsletter, many activities, there's a lot that they do. It's really inspiring to see lots of proactive research, funding, all kinds of different things coming out from the very diverse spread of jurisdictions in America, which is a similar kind of environment here in many ways. And so definitely would encourage those joining today that haven't heard of Archer's work to have a look, to subscribe to updates. We'll share some more links a bit later in the conversation about how you can get involved. But they are doing lots and lots, and it's very interesting to track.
I also wanted to just add, also for context, a little bit about me as a caregiver. So I have worked as a nurse in a lot of settings where I have supported family caregivers and individuals in my nursing role. But I actually started out before I was a nurse as a caregiver. I worked throughout college as a caregiver for individuals with disabilities, and one of those people I took care of ended up becoming my best friend, and she's ironically here at my home today because of our caregiver crisis. Her caregiver called in, and so she had to come and spend the night with me so I could help be her caregiver. I'm also a caregiver for my father who has dementia, and support a young lady who has Down syndrome as a informal guardian. So I live the life of a caregiver as well in a variety of settings, and have had the great opportunity to work with many, many caregivers throughout my career and personally. So it's just really amazing to be in a room with people who support caregivers. I know many of the people that work in this field also have been or are currently caregivers as well. So I just want to acknowledge that this is all about the caregivers.
Definitely. And I know many of those online today, many of those that work with us definitely have their own caring experiences and responsibilities. And it's definitely important to acknowledge that. I mean, I know you're involved in so many other things as well, Kim. I don't know how you have the time, how you find the time to join us today. Did you want to drill into a little bit more some of the specific ways that Arch is looking at innovation and good practice in respite, or respite, as I think you call it over there?
Yes, yes, absolutely. So the Respite Research Initiative that Arch is leading has had a variety of components that have been in play for many, many years, even prior to my connection with Arch. And we'll post a link in the chat later on that dives a little bit deeper into the Respite Research Initiative and all the different activities that have happened. But kind of fast forward to today, the main work of the research initiative is being overseen and advised by the Committee for Advancement of Respite Research. We call it the CAR. And the work of the CAR is working on 3 priority areas. We're working on measuring the value of respite. We're working on identifying common data elements to help create better ability to share data and generalize findings across studies. And then we're also working on trying to help support culturally and linguistically responsive and appropriate research methods to make sure that we are engaging a diverse group of caregivers and being mindful of the equity impact that research can play a role in. And so the project that I'm going to share that I'm really excited about to talk about today is coming from one of those work groups for the CAR, and it is our white paper on measuring the value of respite. Do you want me to go into that right away, or?
Sure. We've got, I will pop the link for this white paper as well. Feel
Yeah,
free to
great.
segue into talking about that if you like.
Sure, great. So the Measuring the Value of Respite white paper really came out of conversations that we had about how, in the US, which our context is somewhat different than a lot of other industrialized countries, developed countries, in that we have a very fragmented healthcare system. We don't have universal healthcare, national healthcare, and oftentimes a motivator for funding and policies to be in favor of respite supports and other caregiving supports comes from research evidence. And so at least that's the hope, is that research helps develop evidence to show the benefits and the value of an intervention like respite, and then hopefully the money and the policies to support that follow. And we currently don't have a large body of research showing the outcomes and value of respite. And in conversations with our national committee that is experts in research and different programs across the country, we talked a lot about how some of the research methodologies that are typically used in identifying value, so looking at cost effectiveness, return on investment, comparative effectiveness, don't make a lot of sense and are really inappropriate to use in the context of respite. And we really talked about how we really almost need to redefine how we think about the value of respite. And so that was really the conversations that set up the need or desire to create this paper. And so in the paper, we outline sort of the background on why it's important to measure value. We highlight sort of traditional methods for measuring value in economic frameworks, and then we propose a new framework to measure the value of respite. So our value of respite model is really the meat of that paper that we're really excited about. We really lended that model from three predominant sort of common theories and frameworks that people may be familiar with. So it's really a blend of the socio-ecological model, the life course framework, and the individual and family self-management framework. And so I can talk a little bit about that framework and how it, I think, helps us see the different aspects that come into play with respite and the outcomes of family caregivers. And we're really hoping that this model is a guide for both researchers and evaluators to think about how they design studies and set up studies, how they evaluate outcomes, and how we really think about value more broadly when we look at caregiver outcomes for respite.
That's great. And I think one of the things we were chatting about when we were planning for this session was even though the funding environment is somewhat different here in terms of how care services are funded, the problem in the conversation really is the same around, at least for us, around conveying the value of respite and traditional models of economic value, particularly not being adequate. And we actually, when we sort of switched your original session, Kim, back in December, we had our Senior Research and Development Officer, Lucas, speak about some of our work on measuring the value of respite, just to sort of add to the conversation. And that recording we'll include the link later on in the session for the recordings of the previous sessions. But in that session and in some of our work, which we've shared with you previously as well, we definitely note that it's hard to demonstrate kind of lasting impact in terms of a lot of the other things that you would use to measure other interventions, because in many ways respite can be kind of a short-term solution. It doesn't solve the problems of caregiving, it just gives kind of a bit of temporary relief. And so we've also been thinking for a number of years, how do we kind of reset the funder expectations around what they're looking for with monitoring evaluation to demonstrate value, because otherwise you get this kind of incorrect view from the data that's feeding through that it doesn't achieve anything, whereas everybody that is involved in the delivery knows and that receives it knows its value. So it's such a timely and relevant question for us as well here in Australia.
And one of the sort of premises that we try to get across in this paper is that caregivers need respite and accrue beneficial effects, even if providing respite doesn't save money. So we really try to shift away from that economic value, but thinking about what's the more global value, as what is the value to individuals, to families, to the community, to the healthcare system, to the workforce by keeping these caregivers employed. There's so many other values that health economists can assign a arbitrary dollar amount to, but we need to stop thinking that it's all about, does it save money? Because that's not the only way to measure value. And so we're trying to shift that to look at what are those caregiver outcomes, what are those societal outcomes that are coming from caregivers who are receiving high quality respite that meets their needs, and what does that look like, and how do we measure that, and how do we capture that in research to be able to compare across studies, because we have such variability in how things are measured in respite research. We have very poorly defined concepts that people are measuring. A lot of times we don't know when someone says we're measuring the impact of this respite program, we don't even know much about the respite program, like what's the dose, what's the frequency, what's the location. So there's really these core components that we think are important to consider. And so we actually are hoping this framework helps get people thinking in a little bit more systematic way and a consistent way across studies, so that we can then aggregate and pull more research together to share these results and have more levers for policy and funding decisions, because we have better evidence.
Definitely. And I feel like we've sort of touched on a bunch of our upcoming questions as well, but was there anything you wanted to add, Kim? You mentioned about sort of where things are at in the US in terms of respite funding and the need for evidence. Are there any key challenges or opportunities you see, particularly at the moment or in the coming sort of months or years in the US context?
Yeah, well, there's lots and lots of challenges, but I think I'll focus on opportunities. I think one of the nice opportunities we have right now in the US is we recently, a few years ago, had the passage of legislation. It was the RAISE Family Caregiver Act. And from that was a call for the development of a national strategy to support family caregivers. And so our national strategy has been published, and there has been some funding to support implementation and infrastructure building around moving forward the strategies that were recommended in that national strategy. We definitely need more. That's a big challenge. Is, we came up with all these great ideas of how we could strengthen supports for family caregivers, and respite being a major component in there from our perspective. But there's not a lot of money tagged along to it yet. But that's a great opportunity because there's this new national conversation that recognizes how important caregivers are to our society. What would happen if caregivers stopped providing care, and looking at the impact of that on healthcare costs and workforce. And so there's a little bit of momentum and shift in our sort of societal views on caregiving and the importance of doing something to better address the caregiver needs. And I think we can attribute a lot of that to the baby boomer generation and the aging population that is really demanding a lot of that. But really, we look across the lifespan too and recognize that there is this urgent need to really strengthen the evidence around all caregiving research, but in our case, really focusing on respite care supports for family caregivers so that we can ultimately create better programs and have better funding to better support family caregivers to get the break that they need.
That's great. And a bit of a shameless plug from our side. We'll come back to this at the end of the webinar. But if people are interested in that international legislation perspective, including the RAISE Family Caregiver Act and strategy, I can see we've got a couple of UK and US people online today as well. We'll be pausing the Innovations in Respite series for the next couple of months due to some other sessions. On the 30th of April, we actually have an international panel featuring UK and US perspectives. And one of the so we're looking at, I guess, using legislation as a tool to raise awareness of caring and improve supports. And we'll be hearing from someone in New York talking about some of the legislation there, I believe touching on the strategy as well. So that's just a bit of a shameless plug for those that want to hear more about some of those broader developments.
Yeah, great.
What do you see as the next steps for the work that you're doing, and what are your leading priorities moving forward?
Yeah. So we're actually right now working on a companion paper for the Value of Respite white paper. So the Value of Respite white paper is out. We encourage you to read it, take a look at the model. But one of the things we recognized was that this would be strengthened by also making recommendations of common data elements to measure the concepts in this model. So, for example, if we're looking at parent stress as an outcome, and with the hopes of improving or decreasing parent stress because of respite being provided to family caregivers, we all measure stress using different tools, different instruments, different surveys. It's very difficult to compare across interventions, across studies. We aren't able to sort of pool the results to show, the cumulative evidence that it is reducing stress. And so through the next paper we're working on, we're recommending common data elements to say, if you're measuring parent stress, we encourage you to use this tool, and here's information of how to access it. And we have a really great table that we're putting together for that paper that will also have, is it available in different languages? Has it been validated? Is it a reliable and valid research tool? And what we found through that process is there's many concepts we want to measure in the framework that there isn't a valid and reliable measure. And so another next step is to look at testing some of the questions that we're proposing and develop new scales so that we have better instruments to measure some of these really important concepts, and create some of those valid and reliable measures to be able to be able to have stronger evidence from the work that we're doing and looking at caregiver outcomes as a result of respite.
That's so great. And again, really, really timely for us in Australia. I know you've seen before some of our national survey results where we look at respite, and we have done lots of different angles of that. We've got our survey being finalised at the moment, but also there's quite a lot of consultation at federal government level here at the moment around some of our key existing data sets, some data linkages that are happening with government data, also some sort of revising some of the big population surveys. So there's a lot of discussion here at the moment about data that relates to respite data. And I keep going to say respite now, respite data. So we will be looking for that companion paper, with bated breath, particularly just to look at some of those, internationally consistent things that we can start looking at and comparing. And even just the question of the practice of kind of research on carers. There's so many different pieces I know that we're aware of or working on at the moment around getting those measures right and considerations for which scales to use. And there's a lot out there, but there's just a lot of, I think, real methodological reflection happening at the moment, which is great for those of us that of the research passion. So it's really great to hear. And in terms of, I guess, do you see, so I guess one of the things that came to mind for me is those common data elements. Obviously, you're looking at them in the US context. Do you see application of those to places like Australia, international contexts?
Yeah, absolutely. And I think we have a great network through the International Short Break Association where we hope to be able to share out and get feedback. And our hope is for that repository of common data elements to be something that grows and evolves. So we're making the white paper, but our vision is to ultimately have a web page that we would continue to update and share links to tools. And as new tools are developed or refined, and we have consensus and feedback from people doing work, that this will evolve over time so that we can continue to develop an even more robust resource for researchers and evaluators who are looking to measure outcomes in respite research.
Fantastic. And we've got a few minutes left of our sort of official conversation. I know, seeing we've already had a question come through that we'll throw to you once we've finished here. If people have questions arising, please feel free to add them in the chat or in the Q&A function. I've seen that first one come through. But my final question for you, Kim, really was, if people today want to learn more, stay connected, hear about future opportunities, what are the best calls to action for them?
Yeah, absolutely. So a couple opportunities to stay connected to this work. First, visit the Arch National Respite Network and Resource Center webpage. You can sign up as a member of that to get their newsletter. And there also is a research consortium that you can sign up to get really specific research information through the newsletter that goes out for that. We also partner with the BRAKE Exchange, which is an international academic practice collaborative. BRAKE stands for Building Respite Evidence and Knowledge. And so that's a partnership between ARCH, the International Short Break Association, and Shared Care Scotland. And we hold webinars. We have a monthly newsletter. We are really trying to match make researchers and evaluators with programs and people interested in doing research, that we can bring that expertise to the questions and problems that people are seeing in practice and policy. And so encourage you to stay connected to that. It's a robust network of almost 300 individuals from 17 countries, and just a great place to network. We do networking hours once a month. Like I said, the webinars, we have an opportunity to fill out a member profile and learn more about each other, and really help partners and collaborators in doing more robust evaluation and research related to respite. So I encourage you to join the BRAKE Exchange. And then ARCH is helping to host our National Lifespan Respite Conference. It's going to be in Albany, New York in May. So just a couple weeks away, but you can still register. So especially our US colleagues, if you're listening to this, there's still time to register and get yourself to New York for an amazing conference where you're going to learn about all the innovations and research that is happening through the Lifespan Respite grantees that are funded entities in the US, and just amazing agenda and keynotes coming in for that conference. There's also the International Short Break Association that is having their International Respite Conference in Chile in 2025. So that will also be an amazing opportunity to connect with other researchers and learn more and network and get more involved in this work as well. So lots of amazing ways to connect and learn from and with each other as we continue to build this evidence base for respite globally.
Fantastic. Lots to be involved with, and also feel free to stay, for those in Australia, connected with us through our e-news and our social media, because as we hear about new publications, have new relevant events and activities, that will always be through our social media and e-newsletter. And we will send the recording of this session as well as previous and future sessions to all people that registered for this series, and that's available on our YouTube channel. And so do stay connected with us as well. In terms of events, I mentioned we're going to pause the Innovations in Respite series for a couple of months because we have some other big ticket items coming up that we want to focus on. And so just to raise your awareness of that, I mentioned the international panel coming up later this month. We're going to hear from some experts in the UK, including Scotland and also New York, on legislation. And it might kind of sound boring to some people, but there's so much interesting stuff happening internationally and in Australia at the moment around legislation as a tool for carer recognition and support. So we're going to have this panel discussion to really think about how legislation can support carers, some of the challenges, some of the opportunities, learnings from a number of different legislative development processes overseas as well. So do join us for that. We're about to start a big promotional push for it, but you can use that QR code, I believe, to register. And then also the Carer Knowledge Exchange is an initiative of Carers New South Wales and the University of Technology Sydney, which has a whole range of opportunities around evidence-based practice and policy. And our big annual event is coming up. It's online over a number of sessions. Those sessions are recorded. So we will have registration details in the next week or so. Stay connected with Carers New South Wales to receive that info when it launches, but please do save the date, particularly for those in Australia, to join us. The theme is going to be sustainability in the caring context. So lots of exciting things coming up. We will share those links with those that are registered and connected with us as well. So thank you for doing that poll. If you still want to participate, that's still up in front of you. And we'll come back now to audience questions. So we have had a couple. I will start with the ones that we've got in the Q&A function here, but if anyone else is wanting to stay and has some questions, please feel free to think about those and add them now, and we'll throw them to Kim. So Kim, we've had a question from Andrew, which is there any evidence on the relative benefit and outcomes on the form of respite, such as respite with or without the person they care for?
That's a great question. I am not aware of any published studies that look at specifically the outcomes of respite, comparing when respite is done with the person you're caring for and out. I think that's a really important question to ask, and I think it's something that we I think really since COVID, we've had to really redefine respite and like what does that look like? I think traditionally respite is a physical break from the person you're caring for, whether that's someone comes to your home and you get to leave, or it's you have your loved one or the person you're caring for attend a community respite program or institutionalize or camp, and there's that physical separation. But during COVID, we really weren't allowed a lot of those options, and so we saw some really amazing creative ways that people were getting that more emotional break when they couldn't get a physical break from someone. Through the Break Exchange, we actually did a survey during COVID to find out what people were doing, how it was impacting respite, and got some amazing creative things that people were doing. And I think that's lingered past COVID, where people are starting to understand that it's not necessarily about a physical break, it's about that outcome of feeling a relief from the caregiving responsibilities, right? And so there's also many models of like respitality across the globe where, you know, you may have people who are doing an outing or going on an adventure camp together, but because it's out of their usual routine and their care routine, that becomes a form of respite because it's breaking up that usual routine that they have at home. and can have some great relief. So I think there's a lot of work we need to do to better quantify and understand that. And to me, in my experience, the type of respite, I don't think there's one type that's better than another. I think it depends on the needs of the family, and that's something we highlight in the value of respite model, is that the respite really has to match and fit the needs of the family, and every family is unique, their context is unique, and that context is gonna change over time. So the type of respite that a family needs when they're caring for a child who is 4 with a disability is very different than when you're caring for a adult child who's in their 20s, you know? So you really have to understand that life course that the family is going through, the relationship between the care receiver, and just the overall context in which that family is and what works best for them. And so it's more about the fit, it's about the matching of the respite to their needs, and there's a lot of factors that come into play for that, and our value of respite model highlights that it, you know, it has to do with, you know, is it the right provider? Is it the right location? Is it the right timing? Is it the right duration? Is it the right dose? You know, are they getting enough more, you know, over time? All of those things are really important to see the benefits of respite. So, lots to be done on that as well, but hopefully, again, the framework will help to spearhead more research that looks at those different factors that I think a lot of current research ignores. And Jill did post a link in the chat too that I just want to call your attention to, that there's a great program that there has been some research done by Laura. So thank you for sharing that, Jill.
Definitely, and that person-centered element or family-centered element is so important. Something actually, some of us may have been at the session in March, where we heard from Professor Mary Larkin talking about relational care models, and looking at that, the importance of considering everyone involved and ensuring that approaches are responsive. And also, I was going to share a brief link in the chat in relation to Andrew's question around sort of models where carers and the person receiving care might be together, and also referring to Kim's comment about making sure it's a responsive approach to the family's needs. I mentioned the Care and Knowledge Exchange project before, so I've just posted a very short snapshot from our last year's research incubator, where we highlighted in the early phases a pilot project that Carers New South Wales was delivering through Carer Gateway called Holistic Respite. We're currently doing a kind of small evaluation of that project because its funding is coming to an end soon. And that is a project where the person-centered, family-centered approach really has been applied, and also where that often includes a break with the person, where that's the preference of the family. So that's something we're exploring in a very small way. Again, you know, looking at bigger evidence and sort of comparative studies is something that we definitely would support. And the other thing to flag as well for future sessions of this series, we may actually report on that project. And also there's a project that is about to kick off with a partner researcher that we work closely with called Associate Professor Mara Hamilton, who's received some federal research funding to look into respite models that actually better suit contemporary employment arrangements. And that's going to probably be featured in this series as well in future. So again, if people in the Australian context particularly are interested in hearing more about those things, please do let us know. We'll include our contact email at the end of this presentation. There's a lot of exciting things happening there. We had another question from Andrew, which was about us, so I think I can answer this one. What is Carers New South Wales doing to advocate for respite / funding for carers that was lost when the Carer Gateway went live? So Andrew, it's probably something that maybe we could talk about in more depth offline, but obviously some of the things I've mentioned, we're doing a lot in the evidence space, we're doing a lot in the policy and systemic advocacy to make sure that legislation, policy, service models are responsive to what the evidence shows us carers need around respite. There's definitely a lot of opportunities, there's a lot of challenges, but that's something that if you want to have a bit more of a chat about with our policy team, you're welcome to. Probably our main work in the area has been a paper called Repositioning Respite in Consumer-Directed Service Systems, which I know we've presented to Kim and Jill's colleagues before about. I might get Mel to put a link to that report in the chat, but that's really a key driver of our advocacy and research around respite. And we will be doing a national survey survey again in June, July this year, which includes a whole number of new questions around respite. So similar to ARCH, research really drives a lot of the systemic advocacy that we do around respite. Did anyone else have any questions that they wanted to pop in the chat or in the Q&A function before we wrap up today? I think we've had another comment from Jill there around, yeah, innovative and exemplary respite services. Yeah, look, I mean, as I said before, ARCH is just doing and featuring some really interesting stuff. So if you want to look at innovation, definitely connect, because I think as well, the recognition of innovation is really important, and sort of supporting small models to share their knowledge and connect with each other is so important, and kind of a similar aim in a very small way to this series for us. And while, you know, our live audiences for these are quite small, we're sharing those recordings as a resource bank. We're also going to be featuring them on our Care and Knowledge Exchange research library so that people can be tapping back into them as well. Great, so Mel's just posted the link to our report there, which again covers off on a lot of the recommendations and evidence that we're drawing on. We, as usual, are probably going to have a little bit of an early finish before 9:15. Did anyone else have any questions, comments for Kim before we wrap up today? I'll just check the chat that I haven't missed
I
any.
just also wanted to share that, again, ARCH has done an amazing job gathering all the outcomes research that has been done. They have an annotated bibliography of all those studies. So if you're interested in just a quick, easy way to see what studies are out there that have looked at outcomes of respite, they're available in that bibliography and summarized there for you as well. So a great resource to kind of get caught up on what research is out there related to respite outcomes.
Definitely, and so important not to reinvent the real wheel, right? To tap
Yeah.
into all the international work that's being done, which is great. And yeah, we really value your time, especially after a long day, Kim. Oh, we've got another comment there from Andy. So yeah, thanks Andy for joining us from the UK. Some international people today. And what works literature review? Please share, Andy, and maybe we can even feature that on a future session. So yeah, please keep us posted. And also to everyone present today, if you're aware of other innovative research or models, resources that should be featured in this series, please do let us know. We're wanting to just put that out there, make it more available for the Australian context. And there's some great stuff happening here and overseas as well. I think that is all of our questions. Published in the next couple of months. We will put you down, Andy, for a future session, maybe post-June. That's excellent to hear. Well, yeah, I think we can probably wrap up now. So thanks again for everyone joining us today live, whether that be at weird times in the UK and US, which I know it is, but also, you know, on commutes and at the beginning of work days, or, you know, during morning caring responsibilities. We will share the recording to this, and we share that with everyone that's registered and publicly, so that people can catch up and tap back into this as a resource. So we really appreciate everyone joining today, and we'll keep you updated about the second report coming out. So yeah, thanks again, Kim, and thank you.
Yeah, thanks so much, and hopefully I'll see you in Australia next summer.
Definitely, we will hold you to it.
All right, take care, everyone.
Take care.